Well, good afternoon and welcome to the United Way of Southeast Louisiana's Public Policy Educational Session 1. This session will focus on community resiliency, youth opportunity, health, and financial stability. I have the honor of serving as chair of the United Way of Southeast Louisiana Public Policy Committee. In my private life, I am the owner of Team of Strategy Group LLC, and I will be your host for today's program. As we get started, I'd like to clarify a few housekeeping rules, and you can see that I am Dr. Toya Barnes-Teamer. So our housekeeping rules are as follows. This session will be recorded and shared with all registrants. There will be a time for questions and discussion at the end of the program, and please share your questions using chat. We will be paying attention. I would like to thank all participants for joining with us today, and you may be asking, why are we hosting these sessions? Well, every year, United Way of Southeast Louisiana creates an agenda outlining our priority public policy issues in community resiliency, financial security, healthy community, and youth opportunity in preparation for the start of each of our legislative sessions. United Way's legislative agenda advances our fight to eradicate poverty in Southeast Louisiana through our Blueprint for Prosperity by supporting ALICE, which stands for Asset Limited, Income Constrained Employed Households. We focus strongly on public policy because it is one of the most effective ways to drive the system level change our community so desperately needs. These educational sessions allow our Public Policy Committee to gain insight from experts on key public policy issues and develop a comprehensive legislative agenda. We also collected information on the legislative priorities of United Way's community impact partners who provide critical on-the-ground services to vulnerable populations across Southeast Louisiana. It is now my great honor to welcome today's esteemed panelists. Jan Moeller with Invest in Louisiana, Todd Batiste with United Way of Southeast Louisiana, Frankie Robertson with the Amanla Group LLC, Sarah Jane Guidry with Crescent Care, Jeannie Donovan with New Orleans Department of Health and Human Services, and Mariah Waneski with Louisiana Coalition Against Domestic Violence. I am now pleased to introduce to you Michael Williamson, President and CEO of the United Way of Southeast Louisiana. Michael will frame today's presentation by providing you an overview of the Alice households in Southeast Louisiana and our bold goal. Please join me in welcoming Michael Williamson.
Thank you, Dr. Teamer, and special thanks to our panelists for today. So let me start. With this. And first of all, and also thank all of you that registered to be with us today. United Way comes in these spaces for one very specific role. We sit at the intersection of data, lived experience, and policy, helping translate what families are facing into information that can guide better decisions, especially at the public policy level. So as we think about this legislative session, I want to offer one simple lens that guides our work here at United Way of Southeast Louisiana. And then we think that every policy question should be tested against one core idea. Is it good for Alice households? These are working families who keep our economy moving. When they struggle, the ripple effects show up across workforce participation, housing stability, health, and education. And as many of you know, if not by now, ALICE is an acronym. It stands for Asset Limited, Income Constrained, Employed. And these are households that earn too much to qualify for many forms of assistance, but still not enough to afford to meet their basic needs, like stated before, housing, childcare, food, transportation, and healthcare. These are not people on the margins. They're childcare workers caring for our children, healthcare aides caring for our parents, service workers, hospitality workers, especially during Mardi Gras, and our first responders. So in Southeast Louisiana, it's no secret that Alice households make up a very significant portion of our population. And too often, policy unintentionally overlooks Alice because eligibility systems were not designed with them in mind. That gap is where families become one crisis away from falling behind. And that is also where smart, targeted policy can make the greatest difference. In response to what we're seeing in the data and hearing from communities that we serve, United Way established our 10-year bold goal to place 100,000 individuals living below the ALICE threshold on a pathway to prosperity by 2035. We chose to be bold on purpose. Incremental change will not close the gaps families are facing today. And this goal gives us clarity and direction at a time when costs, as we all know, are rising, work is becoming more unstable, and public systems are under tremendous strain. But most importantly, the bold goal is not a slogan. It's a decision-making framework that guides how we invest, who we partner with, and how we advocate for systems change. The bold goal is grounded in our Blueprint for Prosperity, which we've been at for a while, many of you know, which is data-informed, community-driven framework that defines what it actually takes for households to thrive. Poverty is not one problem. It is a set of interconnected conditions. Housing affects health, health affects work, work affects financial stability. But the blueprint helps us focus on stabilizing families today while building pathways towards long-term security and stronger community. Now, for policymakers, this framework reinforces an important truth. Families do not live in silos, and policy should not either. Our strategic plan organizes the work into 5 priorities that reinforce one another. From a policy perspective, the most critical is driving systemic change. Programs are essential, they stabilize families, but systems determine whether progress lasts. That includes policies related to housing affordability, childcare access, workforce mobility, healthcare coverage, and disaster resilience. United Way's role is to bring the data, community voice, and cross-sector partners together so policy decisions are grounded in reality and focused on long-term impacts. But we always say at United Way cannot reach this objective alone. We cannot reach 100,000 individuals all by ourselves. Public policy plays a defining role in whether families can move forward or simply remain stuck. Policy determines whether work pays enough to cover basic needs, whether families can access childcare and healthcare, and whether housing remains stable and affordable. The bold goal gives us a clear benchmark to evaluate legislation and corresponding budget priorities. And our advocacy will remain nonpartisan, focused, and rooted in what improves outcomes for Alice households. Today's session, we're so glad you're here joining us, brings together experts covering some of the most important policy issues facing our state. United Way's role in this conversation is to listen, learn, and connect these discussions back to real household outcomes. So as we head into the 2026 legislative session, our guiding question remains simple. Does this policy move Alice households closer to stability and prosperity? Because we can all agree, when Alice households thrive, our entire region grows stronger. Thank you, and back to you, Madam Chairwoman.
Thank you, Michael. It is now my pleasure to introduce Jan Moeller, who is a great friend of the United Way of Southeast Louisiana. Mr. Moeller has spent more than 2 decades analyzing, reporting, and writing about public policy in Louisiana. Since 2011, he has served Invest in Louisiana as its executive director, where he leads an exceptional team of research, advocacy, outreach, and communication professionals devoted to eliminating racial barriers and promoting public policies that give all Louisianians the chance to reach their highest potential. He has an in-depth knowledge of the state's budget and tax structure, healthcare policy, and public safety net. Please join me in welcoming Jan Moeller. Jan?
Um, Hi, everybody, and thank you, Michael, and thank you, Dr. Teamer. And it's such an honor to be here with so many distinguished friends. Well, again, thank you so much to United Way for keeping the spotlight on Alice families. We at Invest in Louisiana focus on tax and budget policy because that's really the means that we raise the revenue we need and we make the investments we need to help Alice families. And that's always going to be our focus. And we just so appreciate the partnership here. Um, so the good news first, I'm going to start with kind of numbers that I think are familiar to a lot of folks, and but that show the depth of the problem. We have the highest poverty rate in the country here in Louisiana. We have the second highest child poverty rate. We have the second lowest household median income, and we have the fourth highest rate of income inequality. I always say we are not a poor state. We are a wealthy state with far too many poor people that need public supports. Um, so the budget came out just a couple of weeks ago from the governor. This is the blueprint that the legislature is going to be working on for the next few months. And the good news is it's a standstill budget. The bad news is it's a standstill budget, and that Louisiana's fiscal picture is going to, frankly, get a lot worse in the coming years. So the budget that you see this year is probably the best budget that you're going to see in the next few years. Um, and there's a couple of reasons behind that. One is the tax cuts that were passed by the legislature in late 2024, which are still starting to take effect, is going to lead to slight reductions in revenue. Um, we know that these changes also shifted the burden of paying taxes from wealthy people and corporations onto low-income families in Louisiana. We now have the 10th most regressive tax system in the country. And we know that there are um, a lot of new costs coming into the state that are rising. So if you look forward, the budget we have right now is balanced. That's by the Constitution. But starting next year, we're going to have a gap between revenues and expenses. The year after that, it's going to get bigger. The year after that, it's going to get even bigger. So what is in the budget and why are these shortfalls back? Well, one is that there are some things driving additional costs to the state. Just because it's a standstill budget doesn't mean everything is at a standstill. So we know that the bill for some of the incarceration changes that were made early in this quadrennial is starting to come due. There's $82 million more for incarceration in this budget. There is more money proposed for vouchers, savings accounts for private schools. Again, the tax structure has become more regressive. There's less revenue. And we could probably spend a whole webinar on this, but there is an enormous shift of costs underway from the federal government to the states as a result of the mega bill, the one big beautiful bill that became law in July, that is pushing a lot of costs, particularly for public assistance programs, from the federal government down to the state level. And if you're familiar with that law at all, a lot of the tax cuts in that bill were front loaded, but a lot of the cuts in that bill are backloaded. So we're going to start seeing the effects of that very soon. Um, What's not in the budget? We saw that there's more money for incarceration and so forth. Well, there's no money for teacher pay raises. Fourth year in a row, there's not a permanent teacher pay raise in the budget. Even though our test scores are improving in Louisiana, our teachers are doing a heroic job, but the stipends that they've been getting for the last 3 years are not included in this year's budget. So unless the constitutional amendment, and we can talk about that if anybody wants to, pass, teachers could actually be looking at a pay cut next year. There is no new money in the budget for early care and education programs. Anybody who works in that sector knows how incredibly large the need is, but there's a standstill funding for that, which prevents a lot of families from being able to go to work because they don't have somebody to take care of their children. There's a 3% cut to higher education. And there are resource needs across state government, but particularly in the Department of Health, because the state is really going to have to do a lot of work to reduce to improve the way that it administers the SNAP program. Because if we don't get our error rates down, that is going to be an enormous cost to state government in just a few years. Um, I'm not going to talk at length about the mega bill, but again, we know that the cost of that bill are going to become very apparent across the state very soon. Medicaid covers 1 in 3 Louisiana residents get their health care through Medicaid. SNAP is about more than 800,000 people. 1 in 6 Louisianans help put food on the table with the SNAP program. And those programs, hundreds of millions of dollars in costs, are coming down to the state. And we already know that some of the effects are already being felt. One of the things the mega bill did not do was renew the Affordable Care Act subsidies that kept health insurance affordable. So about 300,000 people in Louisiana who are in that Alice gap for the most part. They make too much money to qualify for straight Medicaid, but they were buying insurance through the exchange. Their marketplace coverage got a lot more expensive starting in January, and so we know that's going on right now. Uh, uh, so what can we do about this heading into the session? Well, the first thing I think we can do is what the doctors say: do no harm. And so we know that we have a regressive and frankly inadequate revenue structure right now. The governor was quoted in the paper recently as saying he wants to continue cutting income taxes. He might call the legislature into special session. We don't really haven't seen the full effect of the tax cuts that did pass, but the state has to balance its budget. So if we cut more taxes, that is going to require cuts to programs. And again, the state is going to have a lot of problems just affording the programs we already have. Um, and of course, we need more investments, not fewer, in the things that we know will grow the economy. Um, if we want to make things affordable for people in Louisiana, the best thing we can do is finally raise the minimum wage. This is a thing we talk about every single year, but this year, for the first time, there are more workers in America living in states with at least a $15 an hour minimum wage than in states with a $7.25 minimum. Um, the federal minimum wage, which is Louisiana's minimum wage, has not gone up since 2009. We're coming up on 17 years. And if it had simply kept back up with inflation, it would be almost $11 an hour today. I did some back of the napkin math, but I think about 200,000 Louisiana workers today are making less than $11 an hour. So if you're in that group, and those are a lot of Alice families, maybe working 2 or 3 jobs, you're actually getting paid less than the lowest paid Louisiana worker was making at the bottom of the Great Recession. So that is just something I talk about every year, but every year it becomes more vital that we take this step. Um, we do a lot of things in this state to make it expensive to be poor, having to do with fines and fees. Again, this could probably be its own webinar, but we have a user pays criminal justice system. We charge a lot of money to people whose car insurance lapses, whose driver's license may get suspended. We fund a lot of things, including state police pay raises, with the money that we extract from people who maybe didn't have enough money to pay their insurance that month and need to get it back. And we also continue to allow predatory lenders to prey on the most vulnerable people when they need money just to pay their bills. So we can do some reforms there. Um, and then, I wouldn't be Invest in Louisiana if I didn't talk about the importance of tax credits and paid family leave. So this is not a tax session. This is a regular session, but Louisiana's earned income tax credit is a refundable tax credit that puts money back in the pockets of working families. We're lucky to have a credit on the books, but it's one of the lowest in the country. A lot of states around the country are starting to establish their own child tax credit. Louisiana could certainly do that. And then there's been a lot of progress in Louisiana for paid family leave, and a lot of folks coming together around that issue. At the end of the last administration, paid leave was extended to every state employee, classified and unclassified. It's been expanded to college faculty, but we need to build on that. And really, everybody who goes to work should have the ability to take time off for the birth of a child or a serious illness. So that's what I have. I think I just barely strayed above my 10 minutes. But thank you to the United Way. I really appreciate everything you do for the community, and I appreciate everybody for listening and all the great folks. I can't wait to hear what everybody else has to say.
Thank you, Jan. You always do a great job. And for anybody who has any questions based on the information that Jan provided, please feel free to put it in the chat and we will follow up. I now want to introduce someone who is near and dear to me. I have the pleasure of introducing Todd Batiste. Mr. Batiste serves as the Senior Vice President for Education and Youth Initiatives at the United Way of Southeast Louisiana, where he is responsible for overseeing all education initiatives. With a career dedicated to philanthropy, Todd brings extensive experience in designing, managing, and monitoring strategic grant-making initiatives aimed at improving educational outcomes. Please join me in welcoming Todd Batiste.
Thank you, Dr. Tima. Thank you for having me, and good afternoon, everybody. As Dr. Tima said, my name is Todd Batiste, and I have the privilege of serving as the Senior Vice President for Education and Youth Initiatives with United Way for Southeast Louisiana. For early education, we are at a crossroads. We've made incredible gains in early literacy, but sustaining that momentum requires more than just hard work. It requires smart policy. The 2026 legislative session is our opportunity to protect the seats we've won and open doors for an additional 2,500 children we've already brought into the fold. I'm here to walk you through three specific priorities that will place 100,000 of our neighbors on a permanent pathway to prosperity, and the alignment with the United Way for Southeast Louisiana's campaign for grade level reading. To reach our bold goal, we have to focus on what we call the three drivers of success: school readiness, attendance, and summer learning. Our legislative agenda is built to support exactly those pillars. I am extremely fortunate to have as the chair for the Campaign for Grade Level Readings Awareness and Advocacy Committee, Charmaine Cacciopi and Adrinda Kelly, who serves as our lead for policy work. Protecting the foundation is where I'm starting from. Why is this important? The pivot points. In New Orleans, we talk a lot about learning to read, but the real magic happens at the end of third grade. That is the moment children stop learning to read and start reading to learn. The stakes are high. If a child isn't reading on grade level by then, they are 4 times more likely to drop out of high school. This isn't just a school problem. It's an economic justice issue that keeps cycles of poverty moving. We started, only 30% of low-income students hit that mark. Today, we've fought our way to up to 50%. We're on a mission to reach 80% by 2027, but we can't get there without the right state policies. How are we going to get there? Our legislative priorities. Next slide. Our legislative priorities is looking at direct program investments of a total of $190 million. For birth to 3-year-olds, we're looking to invest an additional $95 million this year, with a commitment of $95 million annually for the next decade. This aims to increase the percentage of children served from 18% to 67%. Pre-K and CCAP, we want to protect the 97 million for our pre-K programs like LA4 to maintain seats for the 17,700 4-year-olds and invest in child care assistance CCAP to reinstate at least 720 seats. We're looking for Louisiana's Early Childhood Education Fund, a $30,000 match. The funding match allocating $30 million to Early Childhood Education Fund will fulfill the state's dollar for dollar match promise to local communities. There's lots of momentum. Local investments have reached 27.7 million for fiscal year 2025 through 2026 across 14 parishes, including Orleans, Jefferson, and East Baton Rouge. Codifying the annual match into law to ensure sustainability for more than 1,800 to 2,000 early childhood seats created through these partnerships. These incentives, these are business-friendly incentive tax credits. Continuing to adopt policies like workforce child care tax credit, which was approved in 2025, encourages employers to invest in early childhood education for their own employees. The cost for inaction, oh, I'm not moving my slides. The cost for inaction means that over 7,000 children remain on CCAP's waiting list due to insufficient funding. The family burden, child care average cost of $14,000 per year per child in Louisiana, a cost that rivals in-state college tuition. And the long-term loss, every dollar spent on a child today is an estimated to save $10 in future social cost. So what should we do? We aren't just guessing. We are launching a longitudinal study to improve exactly how these investments lead to family economic stability. We want to show the state that every dollar spent on a child today saves $10 in social costs tomorrow. The action we need to take, we need you to help us make early literacy a citywide priority and a statewide priority. And as we head into the 2026 session, your voice ensures that reading stays cool and, more importantly, stays funded. And lastly, our bold goal. Let's place 100,000 individuals on a path to prosperity. It starts with one book, one child, one vote, and 3 smart legislative votes. So support our agenda. Oops, didn't move my slide. So we ask you to support our agenda as we advocate for those who can't vote for themselves. Thank you for your time, Dr. Tima, and I defer back to you.
Thank you, Todd. And there was one question in the chat, and it was asked whether or not we would be sharing the slides after the webinar, and we will be sharing the slides. So we just wanted everyone to know that. It is now my honor to introduce to you Frankie Robertson. Ms. Robertson is a nationally recognized leader in public health and the founder of the Amanla Group, LLC, a consulting firm dedicated to advancing social justice by addressing the structural determinants of health that impact Black and Brown birthing people. Through policy and advocacy, the Amanla Group works to dismantle systemic barriers and promote health equity. She is also the founder of Black Joy. I love that. A doula firm where she is known as the Capital Doula and Preemie Doula. Black Joy provides doula services, specialized training, and community education with the focus on high-risk clients of color and families with infants in neonatal intensive care. Please join me in welcoming Frankie Robertson.
Thank you, Dr. Teamer, and good afternoon, everyone. It's certainly an honor and a pleasure to be here today. And I wholeheartedly appreciate the work of the United Way in just tackling all things equity, just and justice. So it's always a pleasure and an honor to work alongside you and just witness your heart for community and your resolve for just making sure that people have access to what they need. So thank you. So today I'm going to share a little bit about the Mama Plus Health Policy Collaborative, who we are. The Mama Plus Health Policy Collaborative has a policy agenda that we have been working towards implementing for the past 5 years. The Mama Plus Health Policy Collaborative is a policy-focused initiative that's aimed at addressing the maternal health emergencies and closing the maternal health gaps for Black birthing people in Louisiana. The health policy agenda is comprised of both local and state level policy. Each year, it builds upon the other, and we evaluate what our focus is moving forward, the accomplishments that we've been able to achieve in partnership with many people here today and those who are not today, and we move forward. Our core group is made up of Dr. Lisa Richardson, who's the CEO of the Institute of Women and Ethnic Studies, Mishan Sadiq, who is the founder and director of her institute, Dr. Victoria Williams, who is a member, owner, and advocacy lead for Birthmark, and myself, founder and president of the Amanla Group. And that is the core group that basically creates a strategic direction for the Mama Plus Health Policy Collaborative. So just to tell you a little bit about our areas of focus, when we started this work, we basically resolved to make sure that the myriad of reports that were published by LDH and other entities that plainly stated what the problems were what the problems are and were that needed to be addressed to create better birth outcomes for birthing people of all races and ethnicities in our state, without compromising or ignoring the issue of the disparities for Black and Brown birthing people. We started with something simple, and that was with the reports that were already available that answered those questions. And one common theme that we recognized, that as people were starting to talk more and more about maternal health disparities, in particular, why Black women were experiencing such high rates of maternal injury and maternal death, that they would constantly say, well, why is that? And then you would say, why? And they'd say, no, why is it? And we resolved to say the answers are in front of you. By wanting a different answer or wanting to address it, something more safer or something that didn't require as much political will, that's not going to help us get out of this crisis. So we went through the reports, years and years of reports, found common themes, and created our 9 policy titles for action based upon those. So those 9 titles are listed here. I'll let you go through them and take a look at them for yourself. But basically what this does is this provides a roadmap for us to determine our areas of focus and also be able to develop a strategy and our level of engagement based upon each of these titles. So we've done everything from identify bill sponsors and written or drafted legislation and advocated and lobbied for it, in my instance as a lobbyist, for this, for various issues over the past 5 years. And like I said, in conjunction with many people and many partners on this call, we've been able to move legislation, have instruments filed to just really do everything from change laws to create awareness about issues related to mental health and other things. So if something falls within the scope of these bullets, these 9 titles, we're on it. And whether it's creating awareness, whether it's filing a bill, whether it's advocating alongside of partners who have their own legislation, we will remain focused to support or oppose anything harmful for birthing people in our state, with an emphasis on the health of Black and Brown birthing people. With that, we do not have any legislation that we've actually, actually filed this year. We are prepared to work with partners to support legislation that falls between those 9 titles and to oppose anything that will take us backwards and not produce positive health outcomes for people of childbearing age, and those who are pregnant and postpartum. So, with that, each year during Black Maternal Health Week, which is April 11th through the 17th, we host a Black Maternal Health Advocacy Day. And we've been doing this, I think this is our fourth year for this, but we will be hosting this year's event on April 15th. And we invite everyone to join us. You can take a moment and scan the QR code. It'll take you directly to our Eventbrite link and you can register. We'll start the day with a virtual town hall where we will talk about the legislation that we are asking people to be actively engaged in. We'll start the day with the landscape of Black maternal health in our state, give a little state of the state address about maternal health and infant health. And then we will pause and then convene on the Capitol Gardens and after late morning. And then we also plan to partner again as a part of Women on Wednesday with Lift Louisiana later that day for lunch. So the Eventbrite has all the information you need to join us that day. Also, just to share, one of the things that Mama Plus does is we're heavy on education. We also provide advocacy trainings, and we like for people to come to the table in any way that they are in life, right? Meaning if they're seasoned advocates and they want to know more about how they can impact addressing disparities, or if they're totally intimidated by the system. We probably love them the most because we want to help them feel comfortable, right? And demystify this process and let them know that they belong there and just make this more comfortable for them and meet them where they are and share various levels of engagement that may be of interest to them as they're starting this journey. So we invite the community to join us on March 4th from 1 to 2:30 via Zoom. We're going to have an advocacy training. Some of the feedback that we received from last year was really, really touching. There were people who texted me, people who direct message on social media and reached out and said, I was really intimidated by this process. I feel so informed and I'm ready to go. I feel like I belong there. And those words really still stick with me today. So please share. We'll have it on our social media pages. Registration's not open yet, but we'll have it up by early next week. Also, we were really excited in terms of engaging with Mama Plus and also just being in the know on just everything from how to engage to health topics, learning more about simple things like what is a doula, what's a midwife, everything that you might need to know, especially from a lens of equity. We invite you to make sure that you sign up for the Mama Plus newsletter. We'll have calls to action and we'll also just continue to be very mindful of the educational needs and the unlearning that has to take place when we talk about health and health inequities. So please sign up. And that's it for me. I would encourage you all to follow Mama Plus on Instagram and the Amala Group on Instagram. Being that it's Black History Month, we're super excited to share information about Black History Month and share information about people who have really impacted health and wellness in our country. And we invite everyone to just learn and grow with us and follow our newly created content for Black History Month, but also be ready to be plugged in for the upcoming legislative session. And thank you so much for the opportunity to share today.
Thank you, Frankie, and thank you for being such a great partner and for sharing some wonderful, wonderful information. With that, I would like to now introduce Sarah Jane Guidry. Ms. Guidry is the Director of Policy and Advocacy at Crescent Care, leading state and federal public health policy efforts to expand access to care, strengthen Medicaid, and reinforce Louisiana's community-based healthcare infrastructure. Guidry is a founding member and chair of CARE Louisiana, a statewide public health coalition working to protect and strengthen access to health care for all Louisianians, especially our most vulnerable communities. Through CARE Louisiana, our members coordinate cross-sector strategy, legislative engagement, and administrative advocacy to ensure health policy decisions are grounded in equity, evidence, and real-world impact. Please join me in welcoming Sarah Jane.
Hi, thank you guys so much. I'm very honored to be here today with the United Way of Southeast Louisiana, and especially for convening this space and grounding the legislative agenda and what really matters to families. I also appreciate the conversation and how it treats healthcare not as a silo, but really as a core infrastructure, something that undergirds our community resilience, our workforce stability, our youth opportunity, and our financial security. Medicaid is a large part of this conversation, especially under the BBB, and a lot of that going into effect in 2027. So when we talk about Alice families, people who are working, contributing, and living one emergency to the next, healthcare access isn't abstract, it's very real. And it determines whether someone can keep a job, a child can stay in school, or whether a household can remain financially stable. So this is where CARE comes in. CARE Louisiana is a statewide coalition that exists to advance and protect access to healthcare for all Louisianans. And there we go. So we are very rooted in our values, access to care by removing unnecessary bureaucratic barriers so people can actually receive the care that they qualify for. Respect and truth by centering dignity, data, and lived experiences in the health policy decisions that we make. Excellence and efficiency, so maximizing our taxpayer dollars that Jan was talking about, but while always putting the health of our Louisianans first. So for Alice families, these values translate into something very practical, and that's that coverage that works in real life, not just on paper. So Medicaid is a frontline issue for Alice families, but for all Louisianans, right? And so Medicaid isn't a niche program. It's not a last resort safety net. Medicaid is a healthcare system, and it covers working families that might not have employee-sponsored insurance, caregivers with multiple responsibilities, adults managing chronic conditions, and families whose budgets just don't have room for medical surprises. So when Medicaid is stable, families are healthy and employed. When Medicaid becomes administratively complex or punitive, people lose coverage. And we really want to make sure that the people that are eligible are covered and enrolled. So what we're seeing nationally and what Louisiana is preparing for is a shift towards these policies that can increase paperwork, shorten renewal timelines, and add a lot of reporting requirements. And these changes don't target just people who are working, but most often harm those that are working. And it doesn't always fit neatly into these reporting systems. Our lives are not always, fit into an internet browser. So for Alice families, coverage loss can trigger job instability, medical debt, and long-term financial harm. So, who is CARE Louisiana? So, we are a growing coalition. I'm very proud to say that many of the founding members and the executive team are great partners of United Way Southeast Louisiana. So, we have the Louisiana Primary Care Association, the American Cancer Society, Volunteers of America Southeast, the New Orleans Health Department, Invest in Louisiana, LPHI, Crescent Care, and the numbers are growing. So we're very excited about that. But the coalition is really here to make sure that there's a broad diversity of voices in this conversation of healthcare access. We want to make sure that our advocacy isn't theoretical, but it's informed. And so we have clinics and caseworkers and policy and data analysts and families that are navigating the system in real time that are informing. So the strategies that CARE Louisiana is putting together to make sure that we are at the front line of the concerns that are coming forward is that we're tracking and evaluating, we're doing education, outreach, and navigation. So thank you for inviting me here today. Administrative advocacy and legislative advocacy. And so they all really work together, especially when you get into a really complicated federal state system that's got all sorts of different navigation tools. So focusing just on the legislative priorities first, I want to highlight the 2025 legislative session. So CARE Louisiana is new, but a very fierce group of people came together in 2025, and we passed a Senate concurrent resolution to memorialize Medicaid and have Congress protect that. It was authored by Senator Patrick McMath, and it had many, many bipartisan authors. The Senate voted unanimously, and we only had 7 nays from the Freedom Caucus on the House side. So we're engaging at the legislative level proactively in this conversation. We were at the table when Medicaid legislation was put forward, for example, like Senator Cloud's bill. And a lot of that was also recognized at the federal level. We were able to host Congressman Troy Carter and Minority Leader Hakeem Jeffries at Crescent Care with the CARE Louisiana group because Minority Leader Jeffries actually referenced the Senate concurrent resolution in the debate on the House floor on the big, beautiful bill. So we're very much looking forward to going into the 2026 legislative session. There, as others have mentioned, we don't have legislation specifically. The deadline is at the end of the month, but I would like to say that we are scheduling meetings and staying on top of communicating, especially those on the Health and Welfare Committee. And we're also very much tracking any legislation that's going to impact healthcare or the healthcare systems. So above all, advocating for best practices to mitigate harm is at the forefront of what we're working on. I do want to highlight that, like, as I said before, legislative and administrative work on Medicaid go hand in hand. And so I really want to highlight that we're continuing to communicate with the state Medicaid office and really looking at what the impacts of the OBB, Big Beautiful Bill, HR1, all these big words that we use, but really just making sure that we're having these conversations. And I will say that LDH, as they have said, are committed to making work reporting requirements as low barrier possible. And that's the job of CARE Louisiana, to hold them to that and to continue these conversations. And so I think when we're really talking about healthcare access in this regard, Medicaid is at the forefront of making sure that our ALICE families and our most vulnerable communities are truly centered in this conversation, and that we're looking at every possible avenue to protect them and mitigate any harm that the incoming reporting requirements and any restrictions that might be imposed. I did open it for questions, but that's really all my moment. Thank you guys so much.
You're on mute.
Oh, I'm sorry. I wanted to thank Sarah Jane and Ron. I do see that you have a question in the chat. I'm just going to hold off for 1 minute because Sarah Jane, is not specific to you. It actually is in response to Jan's presentation. So I'm going to go ahead and introduce Miss Jeannie Donovan. So Jeannie, I'm excited to introduce you. Jeannie serves as the Director of Public Health and Policy at the New Orleans Department of Health and Human Services, where she manages strategic policy and programmatic initiatives aimed at improving population health outcomes in New Orleans. Prior to this role, she worked as the policy director at the Louisiana Department of Health, where she oversaw the development and implementation of major policy initiatives, including COVID-19 policy response, Medicaid eligibility policy, and maternal and child health policy. She holds a Master of Public Health and a Master of Public Affairs from the University of Texas and a Bachelor of Arts in Political Science from my alma mater, Loyola University, New Orleans. Please join me in welcoming Jeannie Donovan to today's program. Welcome, Jeannie.
Thanks, Dr. Teamer, and thanks to Charmaine and Michael and United Way for hosting this meeting this afternoon. I really appreciate the opportunity to share and to be with all of you today. I want to start by saying that I serve at the pleasure of Deputy Mayor Dr. Jennifer Abegno and Mayor Helena Moreno And I want to just share that my presentation today does not reflect the mayor's legislative priorities, which are still being finalized. This was really a reflection of what we have been working on in coalition and in partnership. Many of you on the call are participating in those same coalitions, and the policy priorities that we'll be supporting this session and this year. See if I can advance. There we go. Like others have said, I'm going to run through sort of what we're focused on in the upcoming session and year. With some of these will likely turn into legislation that will be filed in the very near future. Others are focused on administrative advocacy, and others we're still deciding whether a bill will be needed or not. So we'll know soon where each will fall. I want to start by talking about increasing access to evidence-based postpartum home visiting programs. Many of you on the call know that the city launched about 3 years ago a universal postpartum home visiting program called Family Connects New Orleans. The year after that, a legislative task force convened and recommended that those programs be covered by public and private insurance and that they be expanded statewide. Since that report was released, we've been working closely with the State Department of Health and Louisiana Medicaid to make those recommendations a reality, and are having really productive conversations and policy development with Medicaid, and continue to work with Representative Stephanie Hilford, who's been a huge champion of this policy effort since the program launched. So ideally, we won't need a bill on this, but remains to be seen. We also are working in coalition to protect patients from extraordinary debt collection practices. You know, in talking about Alice families and the things that cause economic insecurity, medical debt is really at the top of the list for many families. And we expect that to get worse, as Jan described, the folks who are probably going to lose marketplace insurance coverage, and then some of the threats that Sarah Jane shared around Medicaid changes that are coming down the pike. And so we really want to get in front of so starting with extraordinary debt collection practices that include placing liens on primary residences, wage garnishments, bank account seizures, and predatory interest rates. And so we anticipate a bill being filed to prevent those practices from happening in Louisiana. We're also working closely with United Way and others on legislation, bringing back legislation that we filed last session on protecting children from accessing firearms. We know that Louisiana has the unfortunate statistic of being having the highest rate of unintentional child injury and deaths from unintentional firearm use. And we know that our fellow southern states of Texas and Florida have put in place evidence-based policies to penalize those who don't safely store their weapons and a child gains access to them. And so we have tweaked the bill based on the conversation last session and plan to bring that back again this year. We are also planning to expand current state law on expedited partner therapy for sexually transmitted infections. And so in 2008, the state approved 2 infections, gonorrhea and chlamydia, for what's called expedited partner therapy. And that's what allows a prescriber to prescribe treatment not only for their patient, but for their patient's partner without seeing the partner in the clinic. And so the patient can go home with 2 prescriptions and treat their patient so that their partner, so that they're not reinfected and coming back in 6 weeks or half a year with the same infection because their partner never got treatment. And we know that some of the conditions that we want to add to the list in state law do impact preterm birth and low birth weight, and are often recurring infections that women are getting. And so we know that this will have an impact on maternal and infant health outcomes as well, and general quality of life of women. And then more on the defensive side, I shared this slide may look familiar to you all who joined the session last year, but with updated data from the state. We are going to work on making sure we protect our school vaccine schedule. We know that at the federal level, there have been changes made to the school vaccine schedule, and there's a lot of rhetoric around vaccines that is not, I would say, not helpful to parents understanding the risks associated with not getting their children vaccinated. And many state legislatures start before ours, so we get a chance to preview what's happening in other state houses. And we've seen bills being filed to weaken or eliminate entirely the school vaccine schedule. And we know that Louisiana already has very generous exemptions for parents who don't want to vaccinate their children. You don't need a religious or medical exemption. You can just exempt your child. And so we think that that's plenty of sort of parental discretion already in our state law and don't need to further weaken it. We also, see measles outbreaks spreading in Florida and South Carolina, and we just simply don't want our vaccination rates to dip any lower than they already are. You can see these two slides between 2021 and 2025. We saw a 3 percentage point decrease in the number of children who had all their shots complete going into kindergarten. And on the same sort of at the same page, we also have seen attacks on community water fluoridation, which is one of the top 10 public health achievements of the last century. And we've seen some states roll that back. We saw an attempt at this last session in Louisiana, which was unsuccessful. And we know that this, has impacts on children's health, on their educational outcomes, on their attendance, on Medicaid costs. A recent study from the Dental Society estimated that Louisiana Medicaid would incur 1.7 million more in dental costs if we removed water fluoridation from community water systems like in New Orleans. Another policy topic that we'll be working on this session relates to 911 fees. So if you ever look at the fine print on your cell phone bill or a landline, if you still have one, you'll see that there's a small fee related to 911 services. And we know that with the inflation we've seen over the last 5 to 10 years, as well as new technology associated with 911 and digital technologies being introduced, the costs associated with that service have increased, and the legislatively allowed fee has not increased. And so we will be working on legislation to increase 911 related fees to ensure that that service here in New Orleans and in the region and really statewide remains robust and able to respond to calls in a timely manner. And last, I'll just pick up where Sarah Jane left off and say we are a proud member of the CARE Coalition, and we are very closely watching the state's preparedness and policy choices around HR 1 implementation. A large percentage of the New Orleans population, the greater New Orleans population, does receive Medicaid as their primary source of insurance coverage. But I'll say if you look at this map, you'll see the dark blue areas and are actually in the northeast and northern parts of the state actually have the highest rates of Medicaid participation among their population. And so we know this is an important program, especially in rural areas, but definitely in New Orleans. And we want to make sure that that coverage remains robust and easily accessible for all who are eligible. And that this, while the big, beautiful bill was big, it didn't include all of the policy decisions, and it did defer to states on a number of implementation choices, I'll call them. And we want to make sure that, as Sarah Jane said, that our state makes choices that don't further the burden on residents who are already juggling multiple jobs or trying to keep up with paperwork and other requirements associated with safety net programs. And so we'll be working closely with CARE Coalition to monitor implementation in Louisiana. Thank you.
Thank you, Jeannie. I'd like to now introduce Mariah Wineski. Ms. Wineski is the Executive Director of the Louisiana Coalition Against Domestic Violence, the federally designated statewide network of domestic violence shelters and advocacy organizations. She is the immediate past chair of the Louisiana Domestic Violence Prevention Commission, where she served as chair for 7 years. She also serves on the Victim Service Advisory Board of the Louisiana Commission on Law Enforcement and the Advisory Board of the Louisiana Violent Death Reporting System. Ms. Wineski has coordinated legislative policy, public affairs, and media relations for gender-based violence and women's health organizations for over 20 years. Please join me in welcoming Mariah.
Thank you so much, Dr. Teamer. I am very grateful to be able to talk with you all today and share a little bit of the Louisiana Coalition Against Domestic Violence's legislative priorities for 2026. A huge thank you to United Way for putting this call on and for your continued partnership on issues related to domestic violence in our state. So the Louisiana Coalition Against Domestic Violence is the federally designated statewide coalition of domestic violence shelters and advocacy organizations all across Louisiana. So our organization serves to provide a unified voice for the anti-domestic violence movement in our state. Our membership consists primarily of the domestic violence shelters and non-residential advocacy programs across Louisiana. Together, they provide the vast majority of services that are available to domestic violence survivors in Louisiana. So this includes 24-hour crisis hotlines, emergency shelter, advocacy for children who are exposed to domestic violence, legal advocacy and legal representation, support groups, direct housing assistance, and much, much more. So as many of you may know, if you have been involved with this advocacy in the past, Louisiana consistently leads the nation in the rates of female homicide victimization, the vast majority of which is domestic violence homicide. So our rate of women murdered by men is nearly twice the national average in any given year. So if you're looking at this chart, this graph here, you can see that Louisiana's rates of female homicide victimization are the green line, and the national average is that lower line in blue. So this is, of course, only one metric when we are measuring rates of domestic violence and the impact that it has, but it is consistent with many other metrics that indicate that there is a vast need for safety resources in Louisiana. So in 2021, in response to these consistently high domestic violence homicide rates, the legislative auditor conducted a performance audit of our state's response to domestic violence, and it found that Louisiana did not adequately fund domestic violence victim services, which we as advocates have been saying, right, for several decades. But it recommended that the Louisiana legislature allocate consistent and adequate funding for domestic violence victim services. And so the legislature, in response to a robust advocacy campaign that included a lot of folks on this call, a lot of partners supporting our work, they did act and they allocated $7 million in state general funds to domestic violence programs, and that was in 2023. We successfully secured that funding again in 2024 and 2025. We have had to fight for it every year, and every year it has been included as one-time funding. So the purpose and intent of the funding was to expand domestic violence services, specifically in the areas of highest needs across the state. So the results of this investment, now it's been 3 consecutive years of funding, the results have been tremendous. So over the course of those 3 years, it has led to 5 completely new shelters. It has led to 7 expansions of bed capacity in existing shelters. Some of those expansions added up to 20 family rooms in existing domestic violence shelters. So these first two achievements combined have successfully added 328 new domestic violence shelter beds across Louisiana. And in addition to the shelter beds, we were able to establish 11 new outreach offices for non-residential victim services, most of those being in rural communities in rural areas. And then we have also had increases in child advocacy services that are available, clinical counseling available to survivors to help them overcome the effects of trauma, legal services, and of course, intervention programs for those who perpetrate abuse as well. So this has been an investment that has yielded very clear and concrete results, which is not very common in the area of social services when you have so many different factors at play. We can say with certainty, though, that these 3 years of funding have finally moved the needle in a very significant way on domestic violence in our state. So in 2021, before state funds, our state had only 335 domestic violence shelter beds, and we now have over 660. In 2021, the shelters were able to provide just over 55,000 shelter bed nights per year, and last year they provided over 81,000 shelter bed nights. And then one of the key metrics that we look at is the number of unmet requests for shelter. So in 2021 and every year before that, victims were calling needing shelter and were unable to get it over 2,400 times per year. And last year, that number was 1,352, which, while still not perfect, while I still want it to be zero, I want to note that that number is the lowest that it has ever been. And it has consistently decreased every year in the 3 years that we've been able to implement these expanded services. So last year, Governor Landry expressed very vocal support for ending this cycle of us asking for one-time money for ongoing basic needs like domestic violence services. And he committed to finding a permanent way to fund these services in the state budget. And so we have not yet received final confirmation of the inclusion of these funds in the FY27 budget. And the reason that I'm not easily able to say, yes, it's in there or no, it's not, is because the mechanism by which they were adding the funds changed this year, right? So we were told that instead of adding it as a separate line item, that it would be added in and commingled with DCFS core operating funds. And so it's much less transparent whether it's actually in there, but we are working with Governor Landry's office and the legislature to ensure that these funds will be in there and are included in any final budget that comes out. So as we are working to stabilize the state funding, it's really important to realize that these domestic violence shelters assemble their budgets from a combination of state funds, local donations, local foundation grants, and a lot of their funding is federal. And so over the last 5 years, the shelters, just the domestic violence shelters in Louisiana have absorbed over $4 million in cuts to just one of their federal funding sources. So Louisiana received a 42% cut last year to the Victims of Crime Act, or VOCA, funding. And that has resulted in a lot of very painful cuts at local organizations that have relied on that funding. And so while we are certainly celebrating the addition and the continuation of state funds, it's important to know that the impact of those funds has been reduced by decreases in the federal funds at the same time. So while the inclusion of the state funding and making it recurring is our key priority, it is important to note that the actual need, because of those federal cuts that have happened at the same time, is much closer to 10 or 11 million as opposed to 7. So the budget is, of course, only one piece of what is already shaping up to be a very busy legislative session. So outside of our funding efforts, LCADV will maintain our core legislative priorities. So we promote bills that ensure survivor access to justice in both civil and criminal settings. This includes a focus on survivors who have been criminalized or imprisoned for defending themselves against their abusers, and creating pathways for the justice system to reconsider some of those cases. We support legislation that prevents domestic violence homicides in the first place by promoting early accountability for perpetrators of abuse and survivor-centered criminal justice practices. We also support legislation that promotes the economic stability of survivors, because we know that there is no safety without economic security, and it is actually very expensive to stay safe in America and in Louisiana in particular. So that includes things like paid family leave, access to housing and public benefits, childcare assistance, a lot of what other folks on this call today have been talking about. All of that matters to survivors of domestic violence as well. We also support legislation that promotes safe environments. So we truly believe, as naive as folks may think it is, we truly believe that violence is actually preventable, and we work to create environments that prevent violence from occurring in the first place. So we focus on healthy relationships. We focus on concrete supports for families, We focus on creating policies that allow individuals in Louisiana to live safely and to thrive, because those are the things that prevent violence. So there is an issue this year that is different than last year, different than prior years, which is a proposal to create a public registry of domestic violence offenders. So we do honor and recognize the very valid intentions of those who are working for the creation of a domestic violence registry. But there are many, many complex considerations that I hope that you all on this call will keep in mind as you are thinking about this issue during the upcoming session. So with any criminal offender registry, there is an inherent oversimplification that occurs. Right? So domestic violence in particular is a pattern of coercive and controlling behaviors, and the vast majority of domestic abuse does not go reported, let alone convicted, right? So there is a concern that a registry would promote a false sense of security for someone who is in a relationship, and the assumption that because someone is not on this registry that they therefore are not abusive or have not been abusive. And in addition, because of the intimate nature of domestic violence, there are some very valid victim privacy concerns that come with these types of proposals. So the shame and the desire to avoid negative consequences for someone's family might lead a survivor to avoid reporting or avoid seeking help for the abuse in order to avoid their loved one being put on this public registry. There are also a lot of concerns in Louisiana with survivors of abuse being wrongfully arrested and convicted. We know that it happens with some regularity in Louisiana. And so it is possible that somebody who has been arrested and convicted for a situation where they were not actually the predominant aggressor or the abuser in that relationship could be put on an offender registry. And so the inclusion of someone who is a victim of ongoing abuse on a public offender registry would, of course, have devastating impacts for that person's life. Registries are also very expensive, so that is always a consideration. We've talked a lot about the budget. We've talked about the concerns that our state is going to have in the next few years when we come to building a budget that is balanced. And so there are certainly considerations that would need to be made as to the best use of public resources. So I say all of these things not to say that no registry could ever be useful. Okay, but I say it simply to say, please look before you leap when you hear of efforts to create this type of registry, because a lot of times it sounds really good at first, and then when you think about how it might be implemented, it gets a little more complicated than that. So it's important that we keep our efforts centered on survivor safety and survivor autonomy. So thank you again. That covers it for now for this year, but I appreciate the opportunity to share with you all. I'm grateful for all of your advocacy, and I hope that you'll join our legislative efforts this session.
Thank you so much, Mariah. And at this point, we are going to open it up for any questions in the chat. And I did notice one already, so I'll go ahead and ask this to all panelists. The question is, how are organizations preparing for the upcoming cuts? We kind of talked about, the progress that you all have made, but we haven't really closed all of these gaps. So how are you preparing for the upcoming cuts in state funding that was identified in Jan's presentation? And anybody can go, so.
So I think for us when it comes to domestic violence services, like I mentioned, we have been dealing with federal cuts for the last few years, and we've become quite reliant on these state funds to kind of cushion us from some of the more detrimental impacts of those federal cuts. And so it is certainly a concern for us. We're watching it very closely, and we will definitely be advocating for ways to balance the budget by increasing revenue, by making adjustments to our taxation and those types of things that some of the things that Jan was mentioning as potential solutions or potential ways to mitigate the harm of that future budget cut.
Thanks, Mariah.
Um, it's a great question, and it's a key question, and I think a whole generation of legislators in Louisiana haven't been through the budget cuts that happened, I guess, more than a decade now. We from about 2009 to 2016, every year there were deep cuts to the budget, and in some ways, we still haven't recovered. Some institutions haven't recovered from those, but we have term limits in the Louisiana legislature, and so a lot of people who are there now weren't there for those painful years. And so we see the administration is doing some things. They brought on an inspector general, and they are really kind of looking through the couch cushions to make sure that they are being as efficient as possible. And that's not a bad thing at all for state government to be doing. But I think we learned from experience back then that that only gets you so far, that ultimately it's really tough, if not impossible, to do more with less. You generally do less with less. And so there's a whole generation of legislators who haven't sort of learned that or experienced that up close, or had to sit in the appropriations committee during the Christmas holidays and make cuts to higher education and healthcare programs that were very painful because there were mid-year cuts required. So a lot of what we're going to be doing, and I speak only for ourselves, is trying to educate public officials, and that they do have choices in how they raise revenue and how much revenue they raise. This is not a fiscal session. Next year is a fiscal session. It's also an election year. And so politically, it's very difficult to do that. But we do have choices as a state in how we raise revenue, how much money we raise. And my hope is certainly that when these budget shortfalls come, that we don't go back to the idea that the only way to solve these problems is by cutting the budget and by doing kind of temporary one-time revenue sources. If you remember back in the last time we went through this, they were selling state properties and just kind of coming up with all kinds of increasingly desperate measures to balance the budget. I think we can do a lot better, but it's going to take a lot of education of policymakers, because I really don't think this is a partisan thing. I don't think anybody runs for office because they want to cut, they want to see hospitals close, they want to see universities have to cut back and push more of the costs onto their students, or they want to see families struggling to pay the bills, or because they can't afford to put somebody in healthcare.
You're gonna see Racy today.
Hey, I'm sorry.
Pam,
Pam,
you're on mute,
Pam.
Pam. Oh, okay.
Sorry about
Well, that's all I have. But it's a wonderful question.
All right. I'm not seeing any other questions in the chat. What I will say is that there is a reminder of our colleagues to allow us to share their slide decks. There are several individuals who are interested in receiving those slide decks. And I just want to thank all of our panelists before I turn this over to my fearless leader, who thinks that I'm her fearless leader, but I'm not, Charmaine Cassiope, who of course serves as Executive Vice President and COO for the United Way of Southeast Louisiana's Public Policy and Governmental Affairs area. Charmaine has over 20 years at the United Way of Southeast Louisiana. And this has included successfully advocating for the first ever EITC state match, passage of the child care tax credits, implementing statewide high quality early child care rating system, a we know this, fierce champion in the fight against domestic violence, sexual assault, and human trafficking. She has been a driving force for all of us behind landmark policies improving safety and justice for survivors, women, and children, and she does it with so much class and style. I think she should be a reverend, because whenever she speaks, I just want to say, Amen, sister. So with no further ado, I want to turn this over to Charmaine Cassiope.
Well, thank you, Dr. Tima. How honored am I today? And I hope for all of our listeners who are still with us, you recognize, the theme at United Way is United is the Way. You have seen firsthand today through these esteemed panelists the caliber of subject matter expertise, but more importantly, the enormous passion that they hold for sharing the work that we are doing as a United Way in our 7 parish region. Every single day, I learn from these shining stars. And every single day, these magnificent advocates allow us to build a strong and compelling case for not only our Alice families, but for the economic health of this great state. I say thank you from the bottom of my heart for your friendship, for your counsel, more importantly, for what you do to add to the work that United Way is doing alongside you throughout the legislative session and throughout the year. As I close, I just want you to know that United Way of Southeast Louisiana's public policy team advocates all year. As you can see from today's program, we take great pride in working collaboratively across sectors to advance our bipartisan policies in health, education, financial stability, and community strengthening to create a truly equitable community where we will need to engage, we need to work united. And I am here, I would be remiss if I did not acknowledge that a program like today and the work that we successfully implement at United Way does not get done without an extraordinary team. I applaud the fact that every day I get to work alongside Pam Allison, our Director of Public Policy and Community Impact, and even more importantly, today's program brought to the forefront the skills of Marianne, who actually is my fearless partner. Marianne does an extraordinary job in communications alongside Missy and alongside the entire communications team. So for that, I say thank you. This is the first series for educational series. We're going to be hosting another one on March 2nd, and it is my hope that you will continue to engage with, follow, heed all of our action alerts, and continue to participate in all of the seminars and briefings we put together. We need you, and your voice matters. We are very grateful to all of you, and thank you so much, Dr. Teamer, for being such a remarkable host.